Hello, I'm Taif Al-Malki and I'll talk about how depression affects adults who suffer from diabetes. The goal of this literature review is to know the relationship between depression and diabetes and how it affects the life of a person suffering from diabetes. Then we will talk about the statistics and symptoms of depression. And finally, we will learn about the treatment. According to Thomas Willis, the relationship between depression and diabetes is that they are both challenging conditions due to the worsening effects of each when they are combined. Life expectancy is decreased, diabetes self-management is impaired, complications are more likely, and quality of life is diminished. Both patients and economics face significant increases in treatment costs, but these costs do not necessarily translate into significant improvements in health or even quality of life. All of these leads to increased depression to these people who suffer from diabetes. Here we can find out the percentage of patients suffering from depression and diabetes at the same time. According to Anderson, 10 to 19% of people with diabetes show significant depressive symptoms, depending on how depression is defined in that study. The prevalence estimates can differ widely because in some studies, depression is defined based on self-reported high depressive symptom scores, while in others, it's a formal diagnosis by psychiatrists interview. When we talk about the lifestyle of a diabetic who suffers from depression, we must know that this affects so many things in their life. Depression and diabetes are thought to be comorbid due to lifestyle factors. For example, depression can impact health in many ways, including the tendency to eat diets rich in saturated fat, refined sugar, low fruit and vegetable intake, which may contribute to an increased risk of developing diabetes. Diabetes patients were previously excluded from trials examining depression treatment, and so very few studies have examined antidepressants and psychotherapy treatment. But now we know that treatment for depression should be determined individually, including both psychological therapists and antidepressant. Because with diabetes complications, poor metabolic control, and low rates of blood glucose self-monitoring, all protected effective treatment of depression. So both conditions must be addressed equally. At the end, for the best clinical outcomes for people with diabetes, healthcare professionals must diagnose depression and treat it quickly and effectively as soon as it's identified. Depression remains under diagnosis in diabetics, so diabetic specialists would do well to pay attention to this quite common comorbidity. So I think that in order to address this important public health issue, we need novel treatment pathways that can address comorbidity. And that's all. Thank you for listening.